Hi, I'm Karen Marcdante. I'm a professor of pediatrics at the Medical College of Wisconsin, and there I am a pediatric critical care medicine specialist. Pediatrics is amazing right now. With all the change in genomics and what we're going to be able to do, we're going to be able to provide a more individualized approach to pediatric medicine, and we're going to be able to make a real difference. The other hot trend, to be honest, is prevention, because if we can make sure that the kids can not get a disease, then we'll be able to truly make a difference. And now that we understand the mechanisms of disease that happen early in childhood before they're recognized or before we've been even trained to recognize them, then we should be able to create a care plan that helps that child not get ill as an adult. The title of the book is Nelson's Essentials of Pediatrics, and it's currently in the 6th edition. So the major changes from the 5th edition to the 6th edition, we're really trying to tighten things up. We recognize that people are often short of time and need to have the basics and the facts as quickly as possible. So we shortened the book by over 10%. We reorganized it a little bit to make sure that people could find things regardless of what chapter they went to. So it's pretty organized, it's pretty standardized along where you would find different components of whatever issue you're looking into. I worked with Dr. Bob Kliegman for a long time, and on the 5th edition he asked me to become a co-editor, and then when the 6th edition came around he honored me by asking me to lead the editor group. So one of the things that we really focus on is what the learner will need. So whether that's the medical student, which is a large group of our audience, or nurses, or family practice and pediatric residents, we really have tried to focus on that. One of the ways we've done that is by inviting a lot of members of COMCEP, or Council on Medical Student Education in Pediatrics, which is an organization of pediatric clerkship directors. And that group has been very active in designing the pediatric clerkship curriculum, and we've asked a lot of them to author the various sections. We've really been working on helping to connect the concepts in the essential textbook to other areas. So ultimately it can be used by anybody who needs to look up things quickly. It's got an electronic version, so you can search and find that from a computer or from Kindle if you have access, and you can use it regardless of who you are. It might be useful for those emergency room physicians who aren't pediatric trained and just need a quick reminder. We try to put things in the book that will help guide people through the evaluation and treatment of various pediatric diseases. So we'll be focusing some on prevention. We'll be expanding some of our information about genetics and genomics, and we'll be looking at all of those things in the context of every disease area that we have in the book. It has been an interesting experience working with Elsevier. I had never been an editor before. It's been fairly easy. I found them very responsive and very interested in making sure that the product we have is useful for the audience that purchases it. We hope that the people who read our textbook find it useful as they try to manage all of the things that are changing in medicine right now. We know that that happens on an almost daily basis, and I hope that the textbook helps you maintain your curiosity so that you can treat your patients with the best possible knowledge and make sure that you cover the things you need for your exams.